Brittany Mahomes has a message for her fellow moms. Take care of your pelvic floor. Just your daily reminder. Once you have kids, please take care of your pelvic floor. Mahomes wrote in an Instagram story this week. Seriously. From a girl with a fractured back. Mahomes is a mother of two. Sterling, 3, and Patrick, 15 months. With Kansas City Chiefs quarterback husband Patrick Mahomes a year. She didn't go into further detail about how her injury. Some reading her post may have wondered what a pelvic floor actually is. You probably don't know unless you've had some kind of issue with yours, like Mahomes. The pelvic floor refers to the hammock of muscles and supporting connective tissue that supports your pelvic organs, anything below the belly button and between the thighs. For women, this includes the urethra, bladder, vagina, uterus, and surrounding intestines. Pelvic floor issues often come up postpartum and can result in painful sexual experiences. The pelvic floor muscles are very overlooked in most people because you can't really see them. Dr. Cheryl Igelsia, urogynecology specialist at MedStar Health, previously told USA Today, but they serve such an important function so that you're not peeing on yourself. And we can also engage in sexual relations and have orgasms. When women have issues with their pelvic floors, it could mean leaking urine, urinary incontinence, pelvic organ prolapse, organs pressing down or into the vagina, or fecal incontinence. They may also have pain with sex, an issue that is rarely discussed, but that research suggests impacts 10 to 28% of women during their lifetime. Women, and at times men, who encounter issues with their pelvic floors can get help from pelvic floor physical therapists. These therapists will often give patients exercises to improve their aliments. The pelvic floor physical therapists are really specialized in helping women make sure that they're performing these exercises appropriately. Dr. Victoria Scott, urologist and medical advisor at Flow, previously told USA Today, pelvic floor therapy, explained, pelvic floor therapy helps men and women either tighten or loosen their pelvic floor muscles, depending on the issues at hand. Women may be instructed to practice Kegel exercises, squeezing and relaxing of the pelvic floor muscles, for example, to help tighten muscles. Signs women may need tightening if they can't make it to the bathroom on time, or if pee comes out each time they laugh, cough, or sneeze. As for loosening, a lot of women actually have pelvic floors that are too tight, Scott says. So the pelvic floor physical therapist can be super helpful in identifying that, hey, stop doing the Kegels. We need to do stretching and relaxing techniques. Both types of pelvic floor issues can cause pain during sex. What to know before going to pelvic floor therapy? Often to resolve pelvic floor issues, a pelvic floor physical therapist will work with the patient on both internal and external exercises. Look at legitimate databases when seeking care and be wary of any providers that make you feel uncomfortable. Look no further than the Larry Nassar case to see mismanaged pelvic floor treatment. Also be sure to check which therapists are covered by insurance. While you may need to work on these exercises the rest of your life, after all, you want your sex life to be as robust as possible. In addition to maintaining your overall health, don't expect to visit a physical therapist forever. Maybe patients can expect weekly for about 6 weeks, and then at that time, typically as with any other PT like for your ankle or your knee, they might say, "Okay, I think you've got it. Call me if you need me in the future," Scott says. Men may need pelvic floor therapy too. We all have pelvic floors. Though pregnancy can make the therapy more applicable to women, men may also need help training their pelvic floors, particularly when it comes to bladder issues. It can be helpful for some men who have tighter pelvic floor muscles that cause more of a pelvic floor muscle dysfunction, Scott says. So they're not relaxing their muscles properly, and this can cause pelvic pain, urinary urgency, frequency, difficulty emptying the bladder. These men tried a period pain simulator. Their wild reactions carry an important message. Can I try pelvic floor therapy at home? Yes, you'll want to see a doctor first for a quick evaluation and to make sure nothing's wrong. Definitely go if you have blood in your urine or terrible pain. Please don't forget to like, comment, share, and subscribe to my YouTube channel Jaxcey N24. Thank you for watching.